Learning more and more about COVID-19 every day, and contrary to some reports, people with asthma are actually not at increased risk of contracting the virus compared to the general population. However, that does not mean people with asthma should not take precautions to avoid contracting it. Now, to clear up any confusion here, we welcome Dr. Ghassen Kamel, who is a SLUcare pulmonologist. Good morning to you, doctor.
Good morning. Thank you for having me.
You are most welcome. Now, people with asthma do not have a higher risk, but they do have a higher risk of residual complications. Explain.
Yes, from the studies so far, the asthma patients are not at increased risk from contracting the virus compared to the general population. However, if they get the virus, they are at increased risk of having serious complications from it, like any other virus. So they are at increased risk of having serious asthma attacks, resulting in them going to the emergency room and sometimes being hospitalized and even being on life support in the intensive care unit. So that's why it's very important for asthma patients and patients with any chronic lung disease to take the necessary precautions recommended by the CDC.
And you mentioned both asthma and COVID are respiratory diseases. Some of the symptoms are the same. So how does a person with asthma know that they may be infected with COVID?
Yes, you're right. As though COVID and asthma both can have cough and some shortness of breath. So the patients should work closely with either their primary care doctor or their pulmonologist to get familiar with their usual baseline asthma symptoms. And if they notice any significant change in their cough or shortness of breath that is not their usual symptoms that they deal with on a day-to-day basis, then they should have a plan with their physician on how to address those, and maybe contact their physician to see if it's worth being tested for COVID at that time.
And speaking of testing, doctor, is it a smart idea for a person with asthma to get routine COVID testing, or only when symptoms are present?
I think it's only for when they have symptoms and after discussion with their doctors. So far, there is no role for routine testing as of yet. The most important thing is to take the necessary precautions, again, with hand hygiene, mask, and social distancing.
So they should just kind of go, we're seeing video of the, I believe it's a nebulizer or an inhaler. They should kind of proceed with their normal asthma protocol unless something changes.
Correct. So it's very important to continue taking their usual asthma inhalers in order to be able to keep their asthma under control and the inflammation in their airway under control, so that they don't have an asthma attack just because they were not taking their medications. And so far, we don't have any evidence that the inhaled steroids that we use for asthma usually puts you at increased risk of contracting the virus.
Interesting. I did not know that until today. So thank you for clearing it up, doctor. We appreciate your time so much. And for all of those who want to learn more, we will provide a link for you on our website as well as our Fox 2 mobile app.